For the record, Chuck Henry, Director of the Florida Department of Health in Sarasota and Sarasota County Health and Human Services, here this morning for a COVID-19 update. I always like to start these just by expressing my continued thanks and appreciation to all of our staff and volunteers, and there's many volunteers, because they're the ones that really bring success to this operation and work hard every day. That includes both county employees and DOH employees, many with long hours, weekends, and tremendous effort to make all this happen. So I just always like to recognize the people that are really doing the work. I'll start out with the numbers as usual, just to provide that update. Cumulative cases of COVID-19 so far in Sarasota County, 28,515. It's been 1,275 hospitalizations, 777 deaths. Deaths. That's a typo there. It should be 389 linked to elder care facilities, not 3,892. That one slipped by me. I apologize. Positivity rate has ticked up a little bit since last time I was here 2 weeks ago. We went from about 3.6 to right at 4. So we're watching that closely. It's not a big jump, but it's just something we're watching. Case rate also went up a little bit from 218 to 224. That's the average cases over a 14-day period. Hospitalization has continued to drop. Yesterday's hospital rates, so we had 48 individuals in our 4 acute care hospitals with COVID-19, 10 of those in the ICU. Moving on to vaccines. Total individuals vaccinated with 1 or more doses, 152,122, so that number continues to climb. Just over 80,000 of those have received at least a first dose, and almost 72,000 have completed their series, so that looks really good. 34% of our overall population has been vaccinated. Our above 65 group stands at 74%, actually approaching 75%. You'll probably see that number out today, which is really good news. And then the vaccine registry, on the registry that we originally put in place for those 65 and above and healthcare workers, that's now closed, sits at 159,519. There's probably about 10,000 individuals in that we are going back out with a second or third opportunity for vaccine before that one's finally wrapped up. And then in the expanded registry that opened up last Monday, we have 26,488 individuals registered. We're currently serving, because the numbers continued consecutively, up to 171,396. So yesterday we kind of clicked over and began offering appointments to those in the updated registry, because we had gone back out through that 10,000 and offered appointments and got declines or not availables. So in order to try to keep the slots filled, we've now moved into the new registry. Some that have registered as when the new registry opened up last Monday are already getting appointments to move into our clinics. The variant data, which I like to report on, we're now up to just over 1,000 cases reported in Florida, 3 of those in Sarasota County. So we continue to see that. They've resulted in 40 hospitalizations and 7 deaths across the state. All 7 of those deaths have been related to the UK variant so far, but we're watching that closely, and you can see that the majority of the cases with variants in Florida have been the UK variant. The newest executive order that went into effect yesterday continues to include our long-term care facility residents and staff, all persons 50 years of age and older, and healthcare personnel with direct patient contact. I would tell you that most of the healthcare personnel and the majority of long-term care residents and staff have been offered the vaccine. We continue to look for places where new residents are coming in or new staff, but for the most part, those are covered. So we're really focused on that age 50 and over group. We also have, working with the state, directing our homebound individuals to send emails to homeboundvaccine@emmyflorida.com. That gets them into a screening process, and then the state will send teams out to deliver vaccines to those homebound individuals. The only thing we're working on locally around that is we had begun building a list ourselves that we've transferred to the state, and we're just still following up to make sure that all of those got picked up in the state system. We also have a medically vulnerable process. Individuals can download a form that's required that they take to their physician because the physician has to attest that they have a patient-client relationship with that individual and certify that they have a medical necessity for the vaccine even if they don't meet the age requirements. So we have a process in place for individuals to contact the health department's COVID hotline, 861-2883. If they need assistance, once they've gotten that form from their physician, they can call our hotline and we'll get them on a roster. We currently have, I think, about 200 individuals that have contacted us. We've been able to get about 100 of those into some local physicians that are assisting us with those vaccines. So that process is working well. In addition to that, I've begun to release some vaccine to some of our larger practices that have a significant number of medically vulnerable, such as Florida Cancer Institute and some of our larger internal medicine practices so that they can vaccinate their own clients, which is really helpful for us as well. So when I look at what's happening right now, that's probably worth spending a little bit of time talking about. Tomorrow, on Wednesday, we're going to be expanding our vaccine capabilities at Sarasota Square Mall to 2 separate locations within the mall. And so we're real excited about that. That was a real necessity because starting this week, I have about 10,000 plus second doses to give every week for at least the next 4 weeks. That's about as far out as I can see. And in our current space, we max out at about 2,000 a day. So I couldn't really give 10,000 second doses and continue to do first doses in the same space. So we're real excited about moving into that second space and expanding that volume.
Chuck, let me ask a question
Sure.
because I'll have to answer it to my wife when I go home. Are you going to separate out the second doses into a separate facility, or how is this working?
So the plan today is
Okay.
the plan today is to separate those out. And starting on Wednesday, first doses are going to the newest space, which is a little bit further distance to travel from entrance doors into the mall, but it's a larger space. And second doses are coming back to the same space they got their first dose. We thought that would be easier for individuals that have already been there to know they're coming back to the same space.
And if a commissioner, and I don't want to say who, but if I end up in the wrong place, you will publicize that, correct?
I don't know about publicizing that, but I think that's going to be one of our biggest challenges tomorrow
Sure.
and early on. We are working with county communications to put signage up. We have, I believe, blue signage for first doses, green signage for second doses, and we're color coding all the signage in the spaces to help people, and we'll try to get them directed to the right place so they don't get in the wrong lines.
Did you have, Commissioner Ziegler?
On that, I mean, looking at the numbers and just hearing kind of what you're saying, obviously we opened up the registration system to everybody, and I think we only had like almost 30,000 people basically sign up for the vaccine, which is good, but it's not as high as probably a lot of people would expect. So, what's the thinking on having 2 different locations or expanding if we're going to burn through these first dose registrations? I mean, what's your expectation going forward? Because I think that there's a little bit of a concern, not a concern, but a focus on, if we do get through the registration list, maybe there won't be a line for the vaccine right now, right? So, were these plans kind of put in place before, we launched this system and we saw the not so much adoption, or?
So let me answer that by backing up a minute and saying again, for the next 4 weeks, I have 10,000 plus second doses that I need to get to individuals who already received the first dose.
Yep.
Which means if I did those only, I could only do first doses for 1 or 2 days a week, which isn't our goal. We're trying to be available to get doses out. So that's one problem we're dealing with, and the biggest reason that we expanded to 2 sites. These leases are 30-day notice leases, so we can contract pretty quickly when we're ready. And then the second bullet, which is what you're speaking to, we've begun to see an increase in appointment declines and appointment no-shows in our first dose clinics. And we believe some of that is because we've reached the end of the 65 plus registry, where a lot of people didn't take their names out but continue to just decline, or accept appointments because there were 2 in the registry, but only 1 shows up because the other one received a dose. We are concerned about, as the age group drops, what does that volume look like? And we're prepared to consolidate back into 1 space, probably the larger one that we're moving into now, if we see that trend continue. And we'll do that as rapidly as we can.
So, I mean, early on, or a couple weeks ago, or even a month ago, we were talking about, hey, maybe we'll have different locations around the county. But I mean, as we have our registration system and we burn through that, and we just don't have that backlog, it almost makes that unnecessary. Is that correct?
So, we're committed to following the registry because that's what we've told our citizens, that we would take them in order of registration. Speaking of the first doses only, as we still have to move through the second doses, if we don't get more than the 30,000, just under 30,000 that have registered so far into the registry, and we work through those over the next 3-4 weeks, then there'll be no registry to refer to, and we'll have to make some decisions. Do we close the registry? Do I then switch over to working with municipalities and doing geographic pop-ups, perhaps working with not only our cities, but working with homeowners associations that have asked for us to come in? We'll have to go back to them and see, is there still need in their communities?
So it might turn into an on-demand, inside your local community opportunity at that point, right?
It could, but I want to be clear that we're committed to working through the registry first.
Yeah, exactly.
Although,
Yep.
At the numbers that are in there, we'll probably work through that in the next couple of weeks. And then we'll have to look at, is it effective to have some just open sessions where we say, before we shut down the mall site, hey, come on this day, no appointment necessary, and see what we get. We're also looking at what difference does it make? Are we getting a better turnout on weekends? Should we expand hours into the evening? As we move down in age, we're moving into those that are still working, and so appointments during the week, that may be part of the problem in terms of getting people there for their appointments.
So say 200,000 people get this vaccine, are we going to have to repeat this exercise in a year?
Well, I don't know that yet. CDC hasn't determined whether or not we're going to need revaccination or how soon that will happen. As you're all aware, most vaccines have some threshold at which you get a booster. Flu shots, it's annually. Tetanus shots, it's every 10 years unless you have a bad injury, and then they want to give it to you more often. So I'll have to wait for CDC to give us guidance on when that booster is required and what that looks like.
Okay.
And that would change logistically, because obviously the ideal is people are receiving their vaccines from their normal distribution of where they would get any other vaccine. And if the supply lines are there in production,
It might just be a Publix thing.
What Chuck and his public health app will go back to is focusing on the areas of our community, just like he does on other vaccines, where people might not otherwise
Have access.
have access. But I will say, Commissioner, the point I made at the beginning, part of the reason I made the point at the beginning is what you and Mr. Henry just spoke about, is we have a chunk of people under the age of 50 and between 18 who have registered. And it would be nice, as soon as the governor is able to be able to start vaccinating that group too, so we can move through that rest of the that 30,000 or so.
Yeah, it's a promising problem to have
It's a
right
good
now. I
problem,
mean,
yeah.
I guess my question would be too is, when you look at our Everbridge or you look at our text or, any of the other subscriptions that we have with the county where we've helped push out that information about the vaccine, I think it's probably a safe assumption to make is people on that are a little bit older. So the question is how do you go after the 18 plus, 18, up to 30, up to 40, that may not be opening up the newspaper every day, that may not be subscribed to the county government alerts. So what's the plan there? I mean, are we aggressively going after that age group to let them know that, because, I have even 50-year-olds that don't realize the fact that they can go get the vaccine now, because for months we were 65 and up, 65 and up, 65 and up, and now it's changed, and I'm not sure that there's a lot that, I think there's probably people out there that don't know that change has happened.
I would agree with you on that. We are working closely with county communications, and they're very active in the social media on Facebook and beginning to switch our message to try to reach out to all ages. And to Mr. Lewis's point, from a readiness standpoint and what our projected throughput capabilities will be, we are ready should the board wish to encourage through the delegations, more rapid expansion of the age groups, I think we're ready to take on whatever's coming our way and get more vaccine out into our community.
Commissioner Moran.
Chuck, it's absolutely remarkable what you've pulled off. Please pass along our appreciation to your staff and especially the volunteers for pulling this off. It's just absolutely amazing. But I did have a question for you. On your second bullet point of declines and appointment no-shows, do you think there's just a variable here that you might be able to feel a pattern of folks just going back up north, given our seasonal nature of our community?
That could be for the declines, but the no-shows are actually people that accepted, they confirmed their appointment when it came out 2 or 3 days in advance and then didn't show up.
Those are the ones that bothered me the most, because
And-
logistically, Chuck's staff is there, our county staff is there, we set up the volunteers based on the number of people, and they don't show up, it's kind of a waste of resources. And those probably bothered me more than any of the rest of them, is the no-shows.
Yeah, it'll
So-
be interesting to have hindsight's 2020 on this stuff, looking back on why maybe they got it in another community or, again, went back up north to see
And then
family
the
or
question
whatever.
is, why did they confirm if they already had it? And so we
Sure.
believe that a significant portion of those, if you recall, in our registry initially, trying to be family friendly, we allowed 2 individuals to register under each account, so that husband and wife or individual and caregiver could come together. Seemed to make a lot of sense. Turns out in the end, now what we're seeing is we send out the invitation, it can only go to the account holder, and if one of the 2 of those already got their vaccine somewhere else, that person confirms and shows up, but it confirms as 2 in our system. And so we think that's a large part of that problem, which is one of the reasons we switched over in the enhanced registry to a single individual per registration.
I've
Okay.
said since day one on this, Chuck, literally well over a year ago, that you'll never get the credit you deserve on this, but you're definitely recognized from this board. So please, again, pass along the appreciation to your staff.
Commissioner
I will
Cutzinger?
pass that on. They're the ones that really do this work. I just had a couple more
No,
data
one second.
points that are,
One second. Commissioner Cutzinger, I'm sorry.
Yeah, Chuck, it's not lost on me that it was just a year ago this month that this virus was declared to be a pandemic. And here we are, now we're working through the registration and finishing out that 65-year-old. That's, with Commissioner Moran and others, that is absolutely astonishing for the country and for the work that's been done here locally. We've always talked about reaching a point where we have enough doses and we've gotten through the list where then we may be doing some events in other geographic locations, getting South County and other places like that. As we open this up, is that still, I mean, are we still looking to do that now as we open up to the wider range of ages where we can maybe go to other areas and pull from those zip codes and do events throughout the county beyond just the mall location?
yes, sir, that is in the discussion plans and of course, with guidance from the board. Again, we're committed to working through the registry for those
Right.
that have registered. We think we're going to be through the current group if we don't get an onslaught of new registrations within a couple of weeks. So, one scenario is we get a whole bunch more registrations, and then
Right.
then we have to have a discussion. Do we continue to take those strictly in the order received as we have done, and then it only makes sense to have centralized sites. The other opportunity there is to continue to pull from the registry, but make it zip code focused and have events in zip codes pulling from the registry. I'm not going to go there until we have a discussion with the board, and we may not have the opportunity to go there if more people don't register.
Okay.
So if the registry's emptied out, then I'm kind of in a mode of how can I best market vaccine and get it to more people, and whether that's through homeowners associations, through different geographic locations, certainly continuing to work with our minority focus, any way we can to get vaccine out.
Dan, could you just, for folks, and I know we've addressed this, but just if you will, one more time, for folks who aren't able to get out, people who are homebound, people who are not ambulatory or whatever, could you just kind of be very clear about how they respond here and how they get the vaccine?
So for those that are homebound, they're encouraged to send an email to the state, and that email address I put back up on the screen now. It's homeboundvaccine@em.myflorida.com, and they'll get a response from that email with a little survey questionnaire to fill out, and then the state will if it's, once they, it's kind of a screening tool to qualify them. Then they'll assign them to the regional vaccine teams that will come out, call them, make appointments, come to their home and provide the vaccine. If they're unable to send emails, if they don't have access to a computer, they can contact our health department hotline, 941-861-2883, and we'll help facilitate getting them onto that list. That same health department hotline is also where the medically vulnerable call if they have their form completed by the doctor and they don't have access to a vaccine somewhere, and we'll help connect them.
Thank you.
Chuck, I know you have more, but one more
Just-
intermittent question from Commissioner Ziegler.
Yeah, just real quick. So what Commissioner Cutzinger touched on about the geographical areas and what we just discussed a little bit ago, you know, I think you guys have done a really good job of kind of resolving the pain points throughout this process. It's really been a learning process for us. I know Commissioner Cutzinger, I can probably speak for him on this one. There has been frustration out in the community about where the vaccine's been distributed. And I think we can quickly resolve that once we burn through the registration system. If we can go into the cities and basically open up, you know, vaccine on demand and allow them to come in and get that vaccine in their local community and do big public blast. And at least at that point, they realize that we're giving it out in their community at some point. And, you know, same thing with the African-American community, obviously up in Newtown, in the north part of the county. You know, there's been a little frustration with distribution or whatnot. But it seems like once we get through the registration, that's going to give us a lot more flexibility to go out there where we're not sticking to a list, where we're able to go target based on geography. I mean, that's fair, right?
Absolutely.
Yeah, okay.
And there are two, one city and one key area, the city being Longboat Key, that we have not gone out and done because it just hasn't made sense the way we're pulling off the registry. And then to the other far corner in Inglewood, we've not been down there yet either. We're aware of that. And as we work through the registry and it makes sense to focus on other areas, then we will look to do those things.
Great, thank you.
Okay, go ahead, Chuck. Keep going.
So I just wanted to mention, looking at vaccine coverage data, it's really interesting. I told you we're almost at 75% for our 65 and aboves, which is a great number. But the current authorized eligible for vaccine is 50 and above. And because so much of our population is skewed to that 65 and above, as you recall, 164,000 65 and above residents in Sarasota County. When I look at 50 and above, that captures 258,000 residents in Sarasota County. And so when you think that we've already gotten 75% of that 168, we're currently at 56% of our 50 and aboves already receiving one dose or more of vaccines. That's the third highest in the state of all 67 counties. And that's purely a function that so many of our residents are 65 and above that we've been focusing on. And then we have a smaller number that are in that 50 and above group, which may be part of our issue with where the registry currently is.
Okay. Anything else, Chuck?
That's all I have on this topic.
Okay, any other questions?
Just real.
Go ahead.
Schools, have we seen any evidence of that being super spreader by opening up the schools?
We have not seen significant issues in the schools. In fact, the transmission of COVID-19 in the schools has been slightly less than that in the community. And that's been pretty much the experience around the state. And I think that's a tribute to the measures the school board has put in place to try to separate students, to be careful about increased sanitation and cleanliness, and to require masking as much as possible through this pandemic. So it's been very successful.
Hospitalization, did we ever see our hospitals overrun locally?
We have not, and I had those numbers here. We're down to, this is the lowest we've been probably since August. We're down to 48 across 4 hospitals yesterday, hospitalized, 10 in the ICU. And again, that's both the amount of virus in our community that's circulating dropping, but it's also the ability of our medical professionals to use the new tools that are out there to provide treatments and keep people out of the hospital because they've gotten much better at that over the last year.
Okay, and lastly, you know, I know the city of Sarasota was talking about a mask mandate just last week, I think. At what point do we get to normal, you know, operations in the community, right? Who makes that call? who basically, you know, right now there a mask mandate still being discussed. And obviously, businesses are pushing it on, you know, customers. At what point in this process do we get back to where we were, you know, 14 months ago in life and in our community in general? How do you see that playing out going forward?
So I think there's two distinctions there. One is mandates and those things which are really a governmental function that you as a board would control. But if you're asking when does public health feel comfortable that things are moving back to normal, I think as I said at the last presentation 2 weeks ago, when we see the percent positivity drop down below 2% and stay consistent there for at least 14 days, and we see hospitalizations continue to drop, and we're able to sustain that, then I think we're in a more comfortable position as vaccines continue to rise, and we look at those vaccinated with those that may have gained natural immunity from infection. As long as the variants don't change the picture for us, I think we're continuing to move in a good direction, and I expect that we'll probably get there before the summer's over.
So 2% over 14 days, what does that lead to?
Well, it means we still have infection in the community. It means there's still risk in the community, but it means transmission is at a low level. And so when transmission is occurring at a lower level, then I think it's safer to be more of a normal community. Right now, we're still in a low to moderate level, and so there's just a little bit more risk out there. And so we're continuing to, from a public health perspective, encourage people to social distance when they can't, social distance as whenever possible, and wear masks when they can't social distance, even if they've been vaccinated. Now, CDC does have new guidance out that says in households and family situations and some work situations, if everybody's been vaccinated, then perhaps masks aren't necessary. But the more households or outsiders you add to that group, even vaccinated, the greater the risk.
So we're policymakers up here. You guys are obviously the health experts with what you do, but when you say under 2% for 14 days, we can get back to a normal community, what does that mean? What does that look like?
Well, I don't know that I can describe what the new normal will look like, because I don't know that it'll
That's
ever
where I'm
go
trying to
back
get to.
where it was. You know, but I think right now we're all at a heightened sense of protection to make sure that we're social distancing and wearing masks when we can't. And I think that's really good, and I think we need to stay there at least through early summer until more people have been vaccinated and we see those numbers drop. I'm just telling you from my perspective, and that's just Chuck Henry talking, not any big medical experts. I'm just saying in our community, if I saw consistent percent positivities below that 2%, telling me that we're back in a low level of transmission, then I would feel more confident not complaining about policies that you might set.
Thank Thank
Okay.
you, Chuck.
Appreciate it, Chuck.
Okay, buddy. Thank you, Chuck. I just have one comment. It's not about you. You don't have any more questions I don't see from the board, so thank you again. On the recent COG, Council of Governments call, Rob Lewis, Jonathan Lewis, and I, as your chairman, we went through all the different jurisdictions in the county, and it was very interesting. I complimented the school board, and Commissioner Ziegler, make sure everybody there that you know hears about this, that it's just a delight in our county when I watch the national news that got to slow down because of school zones. It's a delight when I get caught up in the drop-off lines. It's a delight when I get caught up in the pickup lines. And I love seeing all the school buses circulating everywhere. We're distinctly different. And Chair Shirley Brown remarked, and I always get a soundbite in about my youngest granddaughter, who started kindergarten, seamless in Sarasota County public schools. She said that when schools opened, they had 70% in person. And last week, when we were on the call, our school district is up to 85% in person. So it shows it can be done. It shows that jurisdictions, for the most part, in Sarasota County are doing a great job. So I add that because Commissioner Ziegler asked you all those questions about getting back to normal, and that is a normalization that I just love seeing. And I watch my granddaughter just trot into school, put her mask on, come back out, go to the playground, do whatever they're supposed to do. And she's the brightest kid in the universe, so I expected
course.
her. I expected her to accept that. But thank you very much, Chuck.